reading a really interesting document from Essity on LinkedIn about embarrassment, and interestingly it talks about bowel dysfunction and embarrassment. And today I have Alison, senior physiotherapist from Belfast, with me. Thank you, Alison, for coming today.
Thank you for having me.
It's a pleasure. And we're going to talk about embarrassment in bowel dysfunction. So you and I have seen many patients that are embarrassed about bowel dysfunction. Why do you think patients are embarrassed?
I think there are levels of embarrassment, and I think some things are more embarrassing than others, and if your bowel is leaking, it's very embarrassing and very difficult to talk about. And I think some things have become less of a taboo over the years, like urine incontinence is maybe slightly less difficult for people to talk about because it's more widely recognised, but I think bowel dysfunction is really difficult to talk about. Even a lot of patients haven't admitted that their bowel is leaking to their partner or their family.
Right.
You know, they try and hide it because it's just so embarrassing, never mind telling anybody else outside of their family. So yeah, it's really embarrassing.
So do you think that creates a problem for those patients that feel embarrassed? Does it create barriers between healthcare professionals?
Yes, I know, I'm sure you find as well that whenever patients actually get to us, whenever they know that we can actually help them, that they are so relieved and then they are happy to talk about it in detail, but to actually reveal that to somebody who hasn't asked them the question. So if their GP has never asked them if they have a bowel issue, or if the health professional hasn't asked them, it's really difficult for them to actually reveal that to anybody.
Yeah. So with these barriers that patients have, I wonder what that does really for them, because I would guess it would create a problem for them in actually getting a treatment, and perhaps they don't actually get referred to anyone for many, many years. So what do you think patients would do if they've got that barrier of embarrassment to be referred for bowel dysfunction? What do you think they will do?
Well, I think a lot of the time they cope they try and cope, and they live their lives and they have to restrict their lives. And if one patient I'm thinking of who he was finding it very difficult to work, finding it very difficult to go out, didn't know that there was anything he could do about it, but it was embarrassing, but it was also very disabling. And I think that's a real shame whenever there is a service. So part of the problem is getting to the service.
Do you think patients, because I know the Essity document talked about a lot of patients go online, and they say that 1 in 4 people go online to self-diagnose, and I don't blame patients for doing that, but what do you think that would do for a patient? Is it beneficial?
I think sometimes it can be beneficial. Sometimes people realise that the services exist because things are online, like your service. I mean, this would be helpful for somebody to find online.
Yes.
But sometimes people get very fearful.
Yeah.
And they start to diagnose themselves with things they don't have.
Yes.
And yes, it can be helpful, but it can be a problem sometimes.
And I guess if they self-diagnose, they think they know what the problem is, so try and treat it and then never actually go to see anybody, which can be quite dangerous as well.
Yes, sometimes. I think, it's good to have the online resources because they are helpful, but yes, people need to be aware that they also need to seek help. And
this is all because of patients being embarrassed.
Yes.
Which is such a shame, isn't it? Because that embarrassment can then turn into anxiety and fear, like you were saying. People can become recluses. So let's discuss about embarrassment and bowel condition and what we can do to help those patients. What do you think that could be?
Well, there's so many things we can do to help, Bridget, and I think that's why we enjoy our job, because it is really rewarding. Because if somebody has bowel dysfunction and they're leaking, or they're really uncomfortable, and you can help them, it's fantastic to be able to help them. And there are loads of things we can do. So as nurses and physios, I think there's a lot of overlap between our roles, and it depends where we are in the country, who does what. But certainly lots of education and lots of different exercises and lifestyle management techniques, and information and support, and then products. So there's so many things we can do. People need to come if they have a problem.
I absolutely agree with that. I used to love the fact that somebody would come in, be very, very embarrassed. This is the first time I've spoken to somebody, and then I could treat them and they would get better. There is nothing like it, is there? That good feeling that somebody was just so embarrassed, but they've come in, been treated, and they've been able to lead a normal life again.
Yeah, and I think actually it has a knock-on effect. I have a patient at the minute who's also lost a stone in weight. She has gained confidence. her fibromyalgia pain has reduced, and that's all because
Wow.
her bowel is allowing her to go out and exercise,
Yeah.
and it has an effect on everything else. You know, bowel
Yeah,
embarrassment.
yeah. So we've had a good discussion today around the topic of embarrassment and certainly bowel dysfunction and embarrassment. I guess the question now is, where do we go from here?
Yeah, I suppose it's difficult, isn't it? Because we can't do it all as ourselves, as one person, but maybe as a group, if we all as professionals talk about it more. I don't know, it is very difficult to know what to do.
It
But
is.
Social media can be used, and
Yeah.
I suppose education as well, because if patients are educated at different points in their life, if maybe there's more education during childhood at school, more education in ante and postnatal care, more education in menopause clinics, you know, those are all points where people can be picked up.
Yeah,
and
yeah.
people can get information, even if that's leaflets
Yeah.
or pointers. But definitely, and I suppose if there's some more on TV, because I think that's a thing where people will pick it up.
Yeah.
But I don't know, what is the answer? We can carry on talking.
We could, and we could talk for a long, long time about how we think it might happen. I guess we just need to be involved, and it's going to take time, isn't it? But thank you so much for today. I really do appreciate your time, and thank you for answering some difficult questions.
Thank you.
Take care.
Thank you.